هلا يا 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 هلا حن قلبي على جمعة الخير هلا حن قلبي على جمعة الخير هلا يا هلا ويا هلا ويا هلا ويا هلا يا هلا ويا هلا ويا
Bismillahirrahmanirrahim. Assalamu alaikum. Welcome, welcome and welcome once again to a gorgeous Wednesday morning in my part of the world. That of course is ITV Networks coming to you live from Johannesburg in South Africa. This is Let's Talk with me, Julie Alli. We will be together till 10 o'clock and as always, lots of interesting discussions are going to be had on the show this morning. If you'd like to become a part of the conversation, you can do so via any one of our social media platforms, or you can call us in on the open line. We're going to be looking at Back a Buddy with the Muslim Students Association. We're also going to talk a Special Olympics. I think they operate kind of under the radar, but they're a very important organization, and let's hear what they're all about and how you and I can support a Special Olympics. But first up, we're going to talk Rare Disease Day, which happens in February every year. Well, not every year, I think it happens once in every 4 years, simply because it happens on in the leap year. So this is in fact a leap year, I hope I'm not wrong. But let's hear what Rare Disease South Africa is all about. And I also understand that there are almost 4 million South Africans that are living with some form of rare disease or the other. And the sad news is that not all of them are diagnosed correctly, and not all of them can and get the type of support they need to get to help them over this horrible hurdle in their lives. Some of them just don't make it through simply because there isn't enough knowledge, understanding and support in place for them. So to talk to us about Rare Disease South Africa, or Rare Disease Day, which is happening later in this month, is the CEO of Rare Disease, and also she is the founder. There's a very special story behind that. Her name is Kelly du Plessis. She has been on the show once before, and a great pleasure to welcome her back on a show this morning. Kelly, lovely to see you again. Welcome.
Thank you so much, Julie.
And I need to ask you this. The last time you were here, we were talking about your darling little boy who obviously suffers from a rare disease. How old is he and how is he doing?
He's currently 9.5 and
Wow.
he is doing really, really, really well. I think better than any of us have expected, but most importantly for me is that he finds a reason to smile every day. And for as long as that continues, my heart will be happy.
And the journey, you know, when he was born and you realize that he has a rare disease, has actually brought you to this point in your life.
Correct.
Okay, let's hold that thought. Let's first unpack rare diseases. Would I be correct in having said that up to close on to 4 million people in South Africa are living with rare diseases?
Correct. So the international prevalence is 1 in 2,000. If you look back at our population size of over 56 million, it is estimated that about 3.8 million South Africans are living with a rare condition. But realistically speaking, the percentage of diagnosed patients is probably 1 to 2% of that, simply because of the fact that our diagnostic capabilities are so poor, and also our understanding. So doctors will often say to a patient, we know you've got something rare, we're just not quite sure what it is. So we're really wanting to improve that.
Rare Disease is an international organization. We are correct in saying that.
So we do work. We are the founding member of a bigger umbrella across Africa called Africa Rare, and we are also affiliated to many of the international members. And then there's Rare Diseases International, of which I am a a member on their patient advocacy group.
Okay, would I also have been correct in suggesting that Rare Disease Awareness Day happens once in every 4 years?
No, so it happens on the last day of February every year, but obviously on the leap years we celebrate extra hard because of the fact that it's a rare year, but it does happen on the last day of February every single year. And the whole idea behind Rare Disease Day really is just for everybody in the community to just take a moment and think, what if I was in that someone's shoes? You know, what if I was one of the rare disease patients? Just to take a moment to understand what these patients go through so that they can receive the necessary support from their community, because it's so important in terms of coping to know that the people around you have somewhat of an understanding. And very often our patients are not, they don't look any different. The conditions are completely invisible to the naked eye. So when you look at them, you think, you know, this person doesn't really look, they don't look sick. So it's just about developing. Has to be okay. Mm-hmm. And it's just about developing that understanding and obviously lobbying to government and policymakers to make sure that they don't forget about us as a vulnerable community, because our needs are excessive.
So how does the lobbying help? Because I understand that there are thousands of different rare diseases. You also said just now that if you're not diagnosed correctly, or the doctors just do not know what disease you have, obviously means that you're not going to get any support, medical and otherwise, and you're just going to be left in a little corner to wither and die.
Absolutely. So essentially the lobbying, and it's taken us 7 years to get to this point, but we are now in a position where we're engaging a lot with Department of Health, and I'm lucky enough to be on a patient advocacy group for the Presidency Health Summit, which has really given us insight into the national health insurance, what that's going to look like, and how we can make sure that the vulnerable communities are not left behind. So it's important to realize what's good for rare diseases will generally be good for any other disease entity, because we are probably the most complex disease group. So if we're advocating for something, it will generally not come as a diminishing of rights in any other disease area. So we're very all-encompassing and holistic. And by doing this, and by this continuous engagement, we are now starting to realize that we have gotten ourselves onto the radar. People in the Department of Health, as well as the Presidency, are actually aware of the fact that rare diseases exist, and that's essentially the start of a bigger conversation. I've just been invited to present at the United Nations. I'll be going over in 2 weeks, specifically to present the South African case study on what movements have happened and how that can be equally translated into other emerging countries when it comes to development of this sort of rare disease policies. So we're very excited. We finally have managed to get onto the radar.
Good luck and all the very best on the attendance at the conference. Coming back to South Africa and possibly other third world countries on the continent, what does the picture look like when you make a comparison to first world countries, for example?
So I think one of the main things that we're lacking is research. South Africa, as part of NHI, is on a big drive to improve local investment. So they obviously are looking at developing their own drug manufacturing entities in South Africa, which is really unlikely that will ever take place in South Africa for rare diseases. And that's where you'd like to be. So the first world countries have a lot of their own research databases and research sets, which help understand the genomes, the issues around their particular group of patients, which really does help. And the other thing is that the investment and the access is much easier in many of the first world countries. So you're not having to reinvent the wheel for every disease group. In terms of drug approval processes, the overseas, a lot of the first world countries have a fast track mechanism in place. So if you are looking to access a drug that is not registered in your country, you can access it relatively quickly. South Africa, we're still slow off the starting blocks in that area, but work is being done to improve that.
And sadly, I don't mean to be careless when I make this comment, you can kind of understand why the funding is very low in this area, in rare diseases, simply because it is a rare disease, and how many people is it going to cover? And we're talking huge amounts of money as far as research and obviously development of drugs to support the particular patient or patients is concerned. So one can kind of understand that viewpoint, but if you're walking or if you're in that situation, you don't kind of look at it that way, because it hurts knowing that your loved one is in this situation and there's no help available for him or her.
Absolutely. That is one of the fundamental challenges, is in the emerging countries, particularly in Africa, we're dealing with the likes of TB, HIV, malaria. Those are not incidences, those are not issues that are huge cost implications to a lot of the other health systems around the world. How do you justify spending 2 million rand on one patient where that same 2 million rand could probably treat 100,000 HIV patients?
True.
So it is very, very difficult. But what we always say is that not everybody needs the same amount of investment. You can't look at it like we're going to invest 5 rand into every person. Some people need 10 rand of investment, some people need 20, some people need 50 cents. It depends on the need. And that's the difference between equal healthcare and equitable healthcare. And so we're trying to make sure that equitable healthcare is what we get out of NHI. So it's very, very, very challenging. But as a parent or as a spouse or as an affected patient, you want to know why your life is valued any differently to anybody else's.
Absolutely. Do we know approximately how many rare diseases are there that are going around, and just how much more work needs to be done in this area?
So we have over 700 listed conditions on our database in South Africa. There's over 6,000, so we know we're missing tons. There is a large sort of increase in identifying patients where there is a treatment available. Not to say that the diagnosis as such doesn't matter to the patients where there isn't a treatment available, but it's not always worth spending the time and the money to get that diagnosis approved when it doesn't change the outcome. You're going to essentially treat the symptoms in any event. So we do find a lot more of the treatable conditions have been diagnosed quicker. And with regards to, I mean, technically speaking, we should have all 6,000. But what makes South Africa unique is our gene structure. So we know that we're a rainbow nation as Africans. A lot of the overseas labs test for genes that are common in their areas. We've got stuff that is novel to us that they won't pick up there. And that's one of the prohibiting factors, is that we're not testing with the filter of looking at it from a South African perspective.
It's frightening, but at the same time, very encouraging knowing that there's an organization like yours that is addressing all of these problems, or at least looking at it. But we need to go for an ad break. We will talk some more about rare disease right after. Kelly du Plessis here talking about Rare Disease South Africa and the day that's going to be happening at the end of the month, and how you and I can participate to make a difference. But all of that right after the ad break. Okay, still to come on the show, we're going to be looking at the Back a Buddy with the Muslim Students Association. We're also going to be looking at a Special Olympics. But right now we're talking Rare Disease Day, which is happening at the end of the month. And the CEO, Kelly du Plessis, is in studio talking about the organization. Now, what is special about Rare Disease Day 2019?
So this year, the theme is Bridging the Gap. And I think the fact that we have finally got government's attention and are on the radar, it's about driving that impact. So now that we've got them to realize that we exist, it's now about actually sending the message that we need investment, we need assistance, and we cannot be forgotten. And with Bridging the Gap, it's bridging the gap from social care to all-round care. So it's remembering things like supporting education, supporting transport, making sure that these patients have spiritual support. It's not necessarily always just about a drug at the end of a drip line. It's, these conditions affect a patient's entire being. And very often I think we forget about that. So we're really wanting to focus on a very holistic approach and make sure that that is incorporated into policy.
And it's not only the patient, it's the 16, 20 people around him that are directly affected by the condition and the support that has to happen as far as the well-being of this patient is concerned. Your interest in Rare Disease South Africa, you're actually the founder. It's a non-profit. You've been in existence for a good few years. Tell us the story about the journey to you being the head of this organization.
So my son was diagnosed with a rare condition called Pompe in 2010. And at the time that he was diagnosed, I was 24 years old. I was pregnant with my second child. Now being told that we had a genetic implication and that my pregnancy might be affected as well.
How was that picked up?
So when John was diagnosed, we had gone through extensive testing for a range of conditions, and it just so happened that the drug company who makes the drug that he actually gets today had met up with the doctor, and he was actually 3 kilometers from our house, and he was one of the few doctors that I hadn't seen. And my son had come out of hospital, and we had been in and out of hospital for probably 2 months. And I went and camped in this doctor's rooms, and out of desperation, and I said, I'm not leaving until I've seen him. And it just so happened that the drug company had actually had a meeting with him in that week. So my son's condition was top of mind for him. It was complete divine intervention. If I had seen him a week before, he probably wouldn't have thought about it. If I hadn't have felt that I needed to go sit in his rooms, or I'd accepted his receptionist saying that he can't see you today and gone into via casualty, I probably would never have seen him. So it was really divine intervention. But when he was obviously diagnosed, there was a 25% risk that my daughter would have had the same condition as well. So we had to go through that whole process in terms of testing her prenatally. And it was just so much to deal with at the time. And I was a young mom, first-time mom, really, what do you know at 24? You think you know it all, and then life comes along and makes you realize you actually have no idea.
Yeah.
And and from there, it was my selfish need really to connect with other parents and people in a similar situation. I needed, you get certain advice from people who've lived it that you cannot get anywhere else. It's invaluable. And I wanted to meet with these people. So I started Rare Diseases with the intention of it being more of a support group, kind of meeting for coffee once every now and again, or moms getting together. And within the first year, we had over 1,000 patients sign up. So I realized very quickly that that was not going to materialize, and we needed to expand it beyond what my initial intention was. And here we sit almost 7 years later with a massive organization.
And you've now gone into Africa as well.
Correct.
So serving the needs of millions more people, obviously. Challenges in setting up Rare Diseases South Africa?
So from an NPO point of view, I think that's, yes, an administrative process, but relatively easy. I think for me, we had outgrown our constitution within the first year. So we had to relook at that. Like I said, because of the fact that I had a much different idea about what we were going to be doing. I think I do feel the pressure. We have done things really well in many ways, and we are considered thought leaders in rare diseases, not only in South Africa, but Africa.
Oh,
so
wow.
I did feel the pressure to go on and help other countries around us, our surrounding countries, and make sure, so we mentor groups in their areas to go on and actually do what we've done here and try do it in their relative countries. So it's a lot of pressure, but I go home and I look at my son and I think to myself, I need to be ahead of the game. I always need to think 5 steps ahead, because when he gets there, I want the work to have been done already. So things like what he's going to look like as a teenager, what working in the workplace is going to look like, disability in the workplace, making sure fairness from an employment point of view, those are the things that we're starting to think about now, so that I know that that ruling is done by the time he gets there, so it doesn't impact him negatively.
When your son was born 9.5 years ago, the future looked really very bleak as far as his survival was concerned. You also talked about what's he going to look like as a young adult, perhaps, and the challenges he's going to face. Did you ever think that you'd reach this point? And do you ever kind of think about the future and the type of support that, if he doesn't get it from outside sources, are you still going to be able to provide?
So it's a very, when he started school, so obviously people put their kids on lists from, I think, the age of 2 or something. We were in November. We didn't have a school to go to for grade 0 because I'd never thought we'd get that far. So I hadn't planned for it. It's very difficult. You want to be hopeful and plan far into the future, but you also want to be realistic and take it day to day. It's very difficult to strike that balance. So when I'm home, I take it day to day. When I'm at work, I try to think into the future. And in terms of the support, one of the big things for me is, what happens if I'm not here? What support will there be for him? We have had parents who have passed away suddenly and left their rare children behind. What happens in those environments? So, and it's by having these discussions, you start thinking of things that you didn't necessarily think of before, such as making sure that other family members are educated on the medicine regime. Other family members have met your doctors. So if you as granny or auntie need to step in, you know where you're going. What happens if mom gets sick and she's not there anymore? I had to have a kidney stone removed.
Oh.
I remember mixing my son's medication the day after I'd had this kidney stone removed. I was in so much pain, but he needed his medication. And I realized then, hold on a second, we need to do more to make sure that there's other people to step in. As much as we don't want it, we want to be in control of the situation, because as a mother, you feel like you know everything and no one can do it as well as you. You also need to be practical and realistic.
Sometimes family members may be well-meaning, but they also believe that I can't get involved simply because it's emotionally draining, or I just can't because I've got my own life to obviously see to. Everyone's carrying stuff around, everyone's got hectic things going on in their lives. So not everyone, as much as they'd love to support you, can't do it. Do you have some sort of a voluntary support, a structure that can come to the fore when you have any form of emergency? And are those structures in place for other people with loved ones suffering from rare diseases?
So we do have a very, very strong community network whereby patients interact with other patients, be it in their area or within their disease group. And those relationships are invaluable. As a mom, if you're having a really bad day, as a patient, if you're having a really bad day, you can generally reach out to that group and find 5 people that are having a good day that can encourage you. Moms will very often jump in to volunteer to go sit with the child in hospital because they know what it's like to be there.
Absolutely.
And, in terms of relying on family, I always say family's got a different role to play. It's more the practical stuff. It's making sure that there's still milk and bread in the fridge, that the other children have been picked up from school and that their homework's done. Those are the things that we as medical parents don't necessarily get to.
Okay. What has this done for you as a person in terms of emotional well-being? It's been quite a journey, 9.5 years. May your son truly strive and carry on and, grow into the amazing adult that you envision for him. But what has it done, to you as a person?
So, to be honest with you, it broke me. And it's only been in the last year that I've realized how much. I think it was in such a tumultuous time in our lives that there wasn't really time to stop and process anything. And it's only now been that he's been relatively well and stable that almost the adrenaline stopped running. There wasn't another crisis to have to get through, that I managed to catch a breath. And in catching that breath, you realize just what exactly you've been through. And I did go backwards for a while. But I've also
And
realized
it's okay.
It's totally okay.
It's
And
part of your journey.
that's
We've
it.
got a minute to wrap up very quickly. Volunteers, do they play a role in your organization?
Yes.
What can we as a general public do to make a difference in your lives?
So from people who are at home, it's raising awareness on social media, telling people about us, telling people the story. If you know someone that you think has a rare condition, let them know about us. If you physically are wanting to get involved, we have lots of events throughout the year where we need physically hands on deck. We have hospital handouts, those sorts of things. So wherever you are in your area, you can always help. Just get in touch with us and we will set you to work in whatever way you are wanting to get involved. We're very, very flexible.
Thank you indeed for being with us, and thank you for being that ray of light and that ray of hope in so very many millions of hearts and homes. Thank you, Kelly du Plessis.
Thank you.
And we wish a long life and good health for your son.
Thank you.
Kelly du Plessis, CEO and founder of Rare Disease South Africa, and it's just made me rethink the status quo. I have a very dear friend whose grandchild suffers from the same disease as Kelly's son, and I kind of have always kept in the background, too afraid to get involved simply because I'm afraid that I might infect the child. But she just told me there are other ways in my extending help, friendship, love, understanding, just by being there, just by picking up the phone perhaps and volunteering from time to time. So lesson learned for me today, and I hope for you too. Let's go for an ad break. And welcome back. Ancilla Smith from Special Olympics South Africa is in studio to talk about this amazing organization and the type of work they're doing, and as always, how you, the general public, can make a difference, how you can be involved, and also if you have a loved one who obviously is mentally or intellectually challenged and you're at your wit's end because you don't know how to keep him or her busy for long periods of time, perhaps these are the people you want to turn to. Ancilla, good morning. Welcome to the program.
Good morning, Julie. Thank you so much for having me here.
Lovely to have you here. You guys are doing some amazing work. But how would you respond to my introduction? People who have children with intellectual disabilities, and oftentimes they may go to special needs schools, so they're kept busy for part of the week or part of the day.
Absolutely.
But come the holidays, come weekends, etc., they really are at their wits' end, because having a child with any form of disability, intellectual or otherwise, is a huge task.
100%. I mean, I think that is exactly why Special Olympics is there. I mean, we are a sports organization, but way more than that. The whole idea is to create inclusive environments where people with intellectual disabilities can come and participate and be offered the same opportunities as anybody without a disability. So we do focus very much on working with special needs schools and centres. The interesting thing with Special Olympics is that we're not an elite sports organization.
Okay.
So we cater for everybody. Through the organization, there's no age restriction, there's no age limit on participation in Special Olympics. And depending on your ability, there is a sport that is specifically designed for your ability levels. So we have our Young Athletes program that's for 2 to 8 year olds, where we focus on gross motor development, early childhood development, and then once children turn 8, they can start participating in Special Olympic sports. And we have athletes going all the way up to 50 or 60 years old. So that is the beauty of Special Olympics. It's a lifelong opportunity for people to get involved.
All right, now when you look at the name Special Olympics, what springs to mind immediately are possibly annual events where your loved one would participate locally and possibly even internationally. But it's way, way more than that. Explain to us how you service special needs schools, or perhaps your child has outgrown a special needs centre or school. How do they still participate, and what is your routine or your daily, your different day of the week look like?
So realistically, I mean, we that is a challenge that we're currently addressing, because the majority of our athletes, obviously, we get in touch with when they're at school. And there is a challenge that once they leave school, obviously a lot of our coaches are based in schools, a lot of our sports programs are based in schools. So we have recently started to develop leagues where athletes that are older can continue to participate because the leagues are not necessarily school-based. So we currently are developing our football league, and we have a netball league, and we also have a floor hockey league. So that is where our older athletes are able to come and participate on weekends or after school hours in their training. One thing with Special Olympics is I must just emphasize that because we're not an elite sports organization, sport for development, so it's very important to us that athletes have the opportunity to compete, to train weekly and to compete regularly. So we don't just focus on our international or national events. We do on average 2,200 competitions a year.
Wow.
To ensure that our athletes have the opportunity to play regularly, because that's the entire idea, is to have something that they can participate in every single week. And they want to compete. So, we can't just ask them to train for an opportunity once every 4 years. We have to give them opportunities to compete at least monthly.
And you have centres throughout South Africa?
Yes, we do. We're based in all 9 provinces currently, and we serve just over 50,000 athletes in South Africa.
So for people watching us this morning and has an older child that has now been through the school system, may or may not have been exposed to Special Olympics, and believe that this might just be the answer for their loved one, what ought they be doing?
There is absolutely, as I said, no age restriction and participation. Any parent, and there's no, oh my goodness, they've missed getting involved when they're at school. No. Our sports do cater for anyone joining at any time in their lives. So it would really just be getting in touch with the nearest Special Olympics program closest to them. And we are very much community-based. So we've trained coaches in our communities, and they can join any Special Olympics program in their local community. If there isn't a program in that community, we are really open to going and training coaches within that community to continue growing Special Olympics. So there's no time of, oh, I've missed the boat. They can join anytime.
Remind us again the different sporting codes that is offered by Special Olympics.
So currently we offer 14 sporting codes in South Africa. So we have our winter sports, which are floor hockey, figure skating, and short speed skating. So we do actually have skaters that go in and participate internationally. And we've just been to Austria for our winter games, and we sent 24 athletes and came back with 26 medals, of which 13 were gold. So
you guys are doing amazing work.
We are doing amazing work. And then we have obviously a range of summer sports, which include athletics, aquatics, we do equestrian, golf, football, futsal, netball, bocce, table tennis. So, there's a myriad of different opportunities for people to get involved in a specific sport that they really enjoy.
And any age group is welcome.
Any age group is welcome.
Is there cost involved for families?
No, that's one thing that we do actually pride ourselves on as an organization, is that there's no cost, there's no fees involved at all for our athletes to participate. We as an organization make sure that we raise the funding to cover all the costs for the athletes.
But obviously you need structure, you need commitment, etc. So what sort of rules and regulations are in place? Because you can't have anybody probably watching us this morning just pitch up at your organization randomly and expect to be a part of a team or part of the group.
Sure.
So what are those?
So we have our national office, which is based in Johannesburg, and then we have provincial coordinators in each province, and then going down from the provincial coordinator, we have district coordinators in each district within a province. And generally an athlete would need to register with the organization before they can participate. And then once they're registered, we obviously have them on our database, and then they can be included in our sporting activities. As I said, we have volunteer coaches that run the sporting activities for us, and obviously all of our volunteer coaches do have a code of conduct that they agree to, and they're all trained in working with Special Olympics and specifically with working with people with intellectual disabilities. So that is the basic structure that we use to manage the organization.
Let's look at the volunteer coaches, for example. So let's assume there's someone that's really good at maybe tennis or aquatics or even golf for that matter, and they're wanting to give back. So they volunteer, and obviously it is what it is, as the name suggests, voluntary. They don't get paid for it.
No,
so they volunteer X amount of their time over a weekend.
Yes.
What are you investing in them in terms of dealing with people with special needs? Because no two people are alike.
100%.
So they are, as a volunteer and even as being part of Special Olympics, you need to know how to interact with people with special needs. And it can be very challenging.
So that is why we provide the training. So all of our coaches go through a Special Olympics training, as I said, which takes a week. And then we have specific deliverables from each coach before we actually certify them, to ensure that our coaches are fully invested and are committed to our athletes. Generally, we have coaches that have been with us for 25 years.
Wow.
So, we just find that it's that organization, when people do volunteer, when they do get involved, the commitment and the passion comes automatically.
And in terms of people wanting to volunteer, obviously they need to come from a sporting background.
Not necessarily, no. As I said, we do the training. We also, once people are invested in the organization, look at opportunities for them to do sport-specific training. We're very excited, in fact, last week, that we completed our very first SAFA accredited level D training course with some of our football coaches. So, we're always looking for opportunities to help our coaches develop their skills. But as I said, we provide the training. So no, anybody can volunteer. And outside of sport, we have our early childhood development. We train our practitioners. So a lot of the practitioners have informal early childhood development centres. So absolutely, once again, we do all the training, we provide the equipment, and we support along the way. For our coaches, we have athlete leadership, we have mentors that come on board that help us develop athlete leaders. We also have a very strong youth activation program where we get involved with mainstream youth to train them to advocate on behalf of people with an intellectual disability.
And I think that's critical in terms of skills for young people who maybe are not gainfully employed. They can truly become associated with your organization. Looks great on their CV, but just imagine the life skills that they pick up along the way.
And I think that for us has also become quite a focus area, that we do try and focus on developing unemployed youth based in the community. And we've really developed some of our strongest volunteers amongst the unemployed youth because, once again, as you said, yes, they do develop skills. We do provide training, and that does give them the opportunity to become employable.
So for people watching us this morning, we know that thankfully a lot of people who can spare a bit of time would want to become involved with Special Olympics. Let's talk, but let's go for an ad break first. Let's come back and then talk about criteria perhaps, because people might be sitting there thinking, I'd love to be involved, but I don't think I have the necessary skills or I won't pass the criteria. But all of that after the ad break.
Thank you,
I'm
Julie.
talking to Ancilla Smith from Special Olympics, and if you're one of those homebodies but want to make some meaningful difference in other people's lives, including your own, then these are the people to talk to. The Muslim Students Association are standing by to talk to us about Back a Buddy. But right now we're talking about Back a Special Needs Olympiad. And of course, Ancilla Smith is here. She's the CEO of the organization. And we're talking about the difference we can make in the life of those less fortunate to us. I must say I didn't hear or haven't heard of Special Olympics in the past. Why have you guys been under the radar?
I think obviously for us, awareness is a huge issue. And a huge part of where we are right now is trying to do that marketing and awareness campaign to get more people to understand what intellectual disability is. I think the biggest challenge with our athletes is 90% of our athletes don't look like they have a disability because it's not physical, so you can't see the disability. And I think that's probably why it is so difficult for people to understand what an intellectual disability is. So we are really embarking on a very, very broad campaign to try and help people understand exactly what we mean by intellectual disability.
And I sincerely hope that by way of this show, we're able to truly create the awareness with as many people as we possibly
Thank you,
can,
Julie.
and also that lots of volunteers are going to come on board. So here I'm thinking this is the type of organization I'd like to be involved with. But how can I make a meaningful difference when I've never ever played sport in my life? I'm not sport-minded at all. How can I become a volunteer and truly touch lives in a positive way?
So, Julie, I was in exactly your shoes. I'm not a sports person. I don't have a sports background. I have an education and marketing background. And when I did my first Special Olympics event, I fell in love with the organization, and I really, honestly, there are so many opportunities that are not directly sports related, but if you do want to get involved in the organization, we provide all the training, all the skills development that you need, and we also provide training on how to work with people with intellectual disabilities. So I know a lot of people not understanding intellectual disability might feel nervous or unsure of how they would cope in that environment. We literally will provide
the necessary
all the training, and I can guarantee that once you've spent time with a Special Olympics athlete, you will be hooked on the organization.
Have you ever had to turn away a volunteer simply because even after the training you picked up that he or she is just not empathetic enough, and they're doing more harm rather than
Then good. Yes, no.
That's number one. And number two, have you ever had to turn away someone that would like to have participated simply because they were so disruptive and they just could not fit into your environment?
So in my experience, no. I mean, I think
to both the questions.
To both the questions. I think that we have a very clear understanding of the different ability levels of our athletes. So we have higher functioning athletes and lower functioning athletes, and it's really a case of pairing the right people with the right experience to work with the different ability levels within the organization. In terms of our coaches, I think I've never experienced a volunteer that's come into the organization that felt that they couldn't continue with Special Olympics. Obviously, we have people who've had outside influences, where work's become too much or, that kind of restriction. But in my entire 12 years of Special Olympics, I am completely unaware of a person who has not been suitable. There are so many ways to be involved within the organization that we literally can find a role for everybody.
Do you find that parents, caregivers and relatives of people that come to you to become a Special Olympics participant eventually become involved in the organization?
Definitely. I must say for a lot of our parents it is challenging, especially our school-going athletes, because a lot of the parents work and a lot of the participation happens during the school week, but we do find more with our out-of-school learners or out-of-school athletes that they get a lot of support from their parents, and we have parents traveling overseas to come and support their family members with intellectual disabilities that are participating. And always we would like more participation from parents, but we also run something called a family health forum, where we actually work with parents of people with an intellectual disability or caregivers or family members, where we also help train them in how to better cope with the challenges that they experience.
So it's not only about focusing on the Olympics and exposing people with intellectual disabilities to different sporting codes. It's also about the support structure that gets all of the support that needs to be had. If you hadn't been on the scene, What do you believe would have happened to those hundreds of thousands of people that you're touching in a very positive way?
Well, I mean, I think that a lot of people don't realize that intellectual disability can be life-threatening. And the reason being is that the majority, and I'm going to say that openly, of the people that we encounter through Special Olympics never had any exposure to healthcare. They generally do not see doctors. They do not get the healthcare that they need. So a huge part of what we do as an organization is health related. We actually do something called Healthy Athletes, where we train what we call our clinical directors, so clinical specialists in 8 different medical disciplines to work with people with intellectual disabilities. And we literally set up clinics in very rural environments, and we will screen up to 500 athletes. 300 athletes at a screening, and we find that a majority of them have issues like tooth decay. A lot of them have high blood pressure, problems that are just never addressed or picked up. And so we do believe that what we do is critical and urgent, because if they do not get that health care, their life expectancy is shortened tremendously.
Why do you think that they're not being supported in that area? Parents and loved ones, why do they fail in giving their loved ones that special health care? I
think perhaps, especially in the case of our athletes, maybe it's a communication, or they're not aware of the health problem. Also, it's a financial issue. A lot of our athletes come from very impoverished backgrounds, and medical care is expensive. Even if there are clinics, it's the transport costs, it's getting them there, it's the waiting time. A lot of parents are working. They don't have the time to get to a clinic and sit for 5 or 6 hours and maybe have to come back the next day and the next to make sure that their children or family members are getting the health care that they need. I also think that perhaps there's a lot of training that needs to be done within the medical field with people, working with people with ID, to better understand the needs of people with intellectual disability, and for medical professionals to better be able to address the needs of people with an intellectual disability. So that is something that we focus on quite extensively, is not only working with our athletes, but trying to ensure that medical professionals have the training to work with people with an intellectual disability.
And to access your services costs absolutely nothing.
Nothing. There is no costs to our athletes.
All right. We've talked about volunteers, how they can also acquire skills by becoming a part of Special Olympics. But of course, they're also going to be giving back. You've talked about family support. What else do you do? And we're going to get to a very exciting trip that you guys are going to be taking to Abu Dhabi shortly.
Correct.
But what else is it that you're doing? I know you guys are very involved in the community.
Absolutely. So, another big project that we're on at the moment, working with the Department of Social Development, is addressing life skills for people or athletes with and without disabilities. So we have worked on an incredible project supported by Lotto with our partner Grassroots Soccer for the last 3 years, where we've actually developed a curriculum for people with an intellectual disability, addressing issues like HIV/AIDS, physical, sexual, emotional abuse, healthy eating, nutrition, fitness. So absolute life skills which are integral not just to people with intellectual disabilities, but to the youth as a whole. And we've been very privileged to be able to start developing holiday camps and areas where we get athletes with and without intellectual disabilities together to deliver a week-long training program in life skills. And also that helps to speak to inclusion and acceptance and a challenging stigma.
You talk about 14 different sporting codes. How big is your venue to be able to accommodate for that? Or do you go to different venues at universities and schools and utilize their facilities?
We are really lucky in that we have we have schools and centres where they do have facilities, and we work very closely with the South African Local Government Association, who also helps to make sure that we can access the facilities that we need for our training and competition purposes.
The special event happening in Abu Dhabi, where you're taking a huge contingent of not only athletes, but support people as well.
Exactly. So we are incredibly excited that On the 7th of March, we leave for Abu Dhabi with a delegation of 98. We have 70 athletes competing against 174 countries currently, and over 8,000 athletes will be gathered. It's going to be the biggest sporting and humanitarian event in the world this year. And we are incredibly excited to be going across to participate. We are currently running a fundraising campaign to make sure that our athletes get across to Abu Dhabi called Adopt an Athlete, where we're asking individuals, companies to pay the costs of getting an athlete to World Games. Obviously, I've already mentioned our athletes come from very impoverished backgrounds, a lot of them, and we like to ensure that they can represent our country with pride. We want them to be able to go and stand amongst 174 other countries and absolutely be proud of being South African. So we supply everything from toiletries to underwear to their playing kit. This time it's going to be sunglasses, sunblock, because we're going to the UAE. I know it's winter, but for us it's still going to be warm. So we need to make sure that our athletes are absolutely prepared. We have training camps that have been going on throughout the past year. We have our final training camp taking place at Parktown Boys in Johannesburg. So we need to cover all of those costs. As we say, our athletes don't pay to participate, and neither do our coaches. So we need to make sure our team is ready to go. So yeah, we're asking South Africa to back our team, and we're asking companies and individuals that are able to contribute to adopt an athlete and help us get our team to Abu Dhabi.
And may you continue touching lives in an amazing way.
Thank you,
With half a minute to wrap up time,
Yes.
your final appeal.
My final appeal is South Africa, back our national team. These athletes deserve your support. They've worked hard, they've worked long, and they are going to represent us amongst 174 nations.
Is the national broadcaster going to be covering the event?
Supersport will be travelling with us, and
Perfect.
I believe that SABC will also be covering the games.
And may you go well and come back home with a gazillion gold medals.
We know we will bring back medals. We know we are.
Thank you for talking to us, and continue the amazing work
Thank
that
you,
you're doing.
Julie. Much appreciated.
That was Ancilla Smith talking to us about Special Olympics. Like I said, I didn't even know that such an organization exists, but there you have it. And of course, if you're sitting there at home wondering, how can you make a difference? You need to get in touch with Ancilla Smith at Special Olympics. Time for an ad break. When we come back, we're talking to the Muslim Students Association of South Africa. And welcome back. We have two young men in studio from us. They're studying at Wits University, and they're also part of the Muslim Students Association of South Africa. I think I've got that wrong, but they will correct me. Somewhere in that name comes the word union, and they'll explain to us why. They're here to talk about Back a Buddy. They're here to talk about their conference coming up in March and a whole host more. The type of support that they give to Muslim and other students on campuses, I should imagine, not only at Wits, but throughout the country. They are Irfan Mangera and Asif Bulbulia. Assalamu alaikum, welcome to the program.
Wa alaikum salam wa rahmatullah.
Thank you for having us.
Lovely to have you guys here. This is important, this is close to your hearts, and this is going to make a difference, a meaningful difference in Muslim students' lives. So tell us what's it all about.
I think for us, firstly, Jazakallah, thank you for having us. The conference itself is aimed at getting young Muslims together to create a sustainable organization, to debate, to discuss issues that are affecting us. And we want to cultivate a consciousness with young people. And that consciousness also must translate into practical steps so that they can go out and in whatever fields they go into, in professional fields, they must be able to make changes and be an active citizen in South Africa. So that's the gist of it. I think Asif would...
All right, so when's it happening? And obviously Irfan has alluded to young people. Let's look at the young people you're targeting. Would this be only uni students? Are you looking at young people right across the board?
So effectively what we're trying to do is, it is primarily aimed at university students across the country. And with particular attention paid to members of the Muslim Students Association, people who are working within the organization. But we're also trying to open it up as much as we can to young Muslim people across the board.
So you're not going to stop anybody who is not at WITS or any tertiary institution.
Yeah.
They're probably out in the workforce already working or whatever else it is that they're doing. They are able to attend this conference.
Yeah, by all means.
I think on that as well, it's just that MSA has been in existence for a long time. So we have a large alumni structure. And with that, they've always contributed towards, discussions or basically keeping the organization going. And they're in various fields already. So we're opening it to them as well. We're hoping that we can get like grade 11s and 12s also into the conference, because they ultimately will inherit the organization when they come to
Okay.
campus.
When and where is this taking place?
So it's going to be taking place from the 27th of March to the 30th of March at the Image Lifestyle Center in Fordsburg, inshallah.
Okay. There obviously are costs involved. Let's talk about what the costs are, what does it cover, and when, how does one obtain tickets to the event, obviously?
So with regards to that, we're trying to keep it as minimal as possible for students, because it is difficult. So it's 400 Rand for a student from outside of Gauteng, and 300 if they do stay in. The costs are quite high because transport and accommodation is quite expensive. So the budget already for us is around 300,000, and that's why we initiated this fundraising campaign online. It's a Back a Buddy campaign, and we hoping that we can draw in funds from that, so that we can even subsidize certain students who can't afford the tickets.
Attending the conference.
Yes.
What is that 300 Rand? Let's assume you're a local student at WITS or UJ. What does the 300 Rand cover? And is it a 2-day conference?
So it's from Wednesday evening to Saturday, and it basically covers our conference packs, it covers accommodation, it covers, if you're staying in, we would prefer you not using the accommodation, because we want as many students from outside to occupy those rooms. However, there is food also for all 3 days, 3.5 days.
Breakfast, lunch, and supper.
Yes.
Okay.
And if I could add to that, there's obviously the aspect that we want to bring in speakers from other parts of the country, so to cover those sorts of costs as well. Because we believe that they have valuable insights to offer in the various issues that we want to address throughout the conference.
Now, obviously, you guys are at uni. The Muslim Students Association has been around for a very long time. It started out to perhaps just create a bit of a support structure for Muslims from around the country entering university. It is very overwhelming, I should imagine. You come from a school system that we've been exposed to, and then you've got to be in a university environment. There's no gap in between. So MSA was there and is still there to support and possibly to hold your hand through the first few very traumatic months of your uni life.
It really is.
How has MSA grown, and do you truly believe that they're adding value? I know they've made a difference, like insisting on halal meals on campuses. They have musallas throughout and other such support structures that caters for our spiritual needs. But what else is MSA now doing? Because they must have grown by now. They must have evolved by now.
Yeah. I mean, if we consider the context from which the MSA emerged, right? The MSA was founded around 1973, 1974. Sure. In the sort of aftermath of the death of people like Imam Harun, and in order to address the need for not just representation of Muslims at university, but also the mobilization of Muslims around, addressing the issues of that time in that context. And between then and now, we have at the moment around 23 chapters across the country. And obviously over time, with every committee that comes in, there's ideological shifts and changes. But at the heart of the MSA, it's always been about building an Islamic movement aimed at addressing not just Muslim issues, but catering to the needs of the marginalized. And and trying our best to build capacity, to develop skills within our organization and within the society at large. At the moment, MSA portfolios and MSA chapters across the country deal with a number of issues, whether it's community outreach issues or community outreach initiatives, or in the field of politics and transformation, so engaging with real political challenges that we're dealing with in our context. There's a lot of skills development that also takes place within the committee. I can speak from experience. Alhamdulillah, I was blessed with the opportunity to be the chairperson of the MSA chapter at Med School and Education campus. And, if I had to compare where I was at the beginning of that term to where I was at the end of the term, I know that my capacity as a leader, my capacity as in terms of the skills that I gained was phenomenal.
Teaches you responsibility.
Yeah.
Teaches you how to interact with people and a whole host more. Yeah. And I always say it's going to look great on your CV. So you talk about 23 chapters around the country. What exactly is their role? And how do you keep in touch? And how do you keep them mobilized?
So I think with the MSA, the union restructured again a few years ago.
Okay, where does the word union come into all of this? I refer to it very loosely as the MSA, and that's what I've always known it as.
So the union is basically the national body of the MSA.
And who are they?
So they elected by the chapters so they are the national committee to oversee them. Are you part
of the union?
No, I'm serving as the current Secretary General
of the union.
Okay. And my term will end in September. It's a 2-year term. The union is basically the unification of all the MSAs in the country. So to create one vision, one like a framework for us to work in, and to represent the MSA basically on national issues and also international issues. So it's developed over time, and like you mentioned, the change in committees, you always have differences, and sometimes a committee...
How do you deal with that? Because obviously you have lots of hotheads, people with different ideologies, thoughts, perspectives, take on different issues. It can become very heated.
It does get heated, and the thing is, I think with the MSA as such, our role isn't exactly like a theological body or an ulama body. It's young people.
More political.
It's more social and political in the sense.
A little bit of everything.
Yes, it's a little bit of everything in the sense, and that's why it's young people elected by other young people to carry out that sort of work. And with regards to what the union has been doing in the last few years, because the capacity has lacked, I think it's to rebuild the capacity that we had in the past. And that means that we have to establish good communication channels, we have to get a good revenue stream in so that we can run projects and campaigns consistently and sustainably. And that's the aim for this conference, is that we create that framework so that now we can cement for the next 20 years, 25 years, a program of action for young Muslims across the country.
Okay, we'll talk more about that right after the ad break. And there you have it. Irfan and Asif are here from Wits University. They're both currently studying at Wits, and they're here to talk about Back a Buddy campaign, and they're also here to talk about the upcoming conference which is happening in March, and a whole host more, the role of the MSA in our children's lives at universities throughout the country, and how we can make a difference, how we can support them, and how we should be standing by them, very especially with Back a Buddy. More of that right after the ad break. To talk to us about the Muslim Students Association, how far they've come. They've been in existence for almost 50 years now. The difference they've made in the students' lives over time as they've navigated their lives and their way through university, and what they can do, in fact, meaningfully to make a difference in the lives of current and future university students. So there you have it. It was a very loosely formed organization some 40 odd years ago. You are studying at university, and both of you believe that the MSA has a huge and a very important role to play, and it can be bigger than what it currently is. Yeah. Does it have the teeth to do that?
I believe so. I'm somebody who believes that, we shouldn't underestimate our capacity as individuals to influence positive change in our society. And personally, I know that I am where I am today, particularly within the MSA, because previous committees and previous generations of people have put in the work that they needed to put in order to continually build the organization and keep on passing the baton on. And my vision for young Muslim people, my vision for our organization is to create, the sort of critical mass that's needed to really mobilize young people and get them involved in, just changing their society for the better and doing whatever they can to utilize the strengths and the talents that Allah has blessed them with in order to make a positive difference.
And being at university, you can't kind of just cut yourself off and just bury your nose in books and forget the rest of the world outside of you. Structures like the MSA and other societies play a huge and a very meaningful role in your lives because it helps to shape you. Yeah. You are the future leaders of tomorrow. And if you can take out all the positivity and make a meaningful difference, it's going to very definitely grow you as a person. Yeah. But do you find that certain students use these type of societies as a cop-out from their real work at university?
I would think some do, but in the general sense, over time, we've seen a lot of hardworking individuals who've come through and helped the organization to where it is today. And like Asif mentions, the sustainability. So committee after committee, because it changes, sometimes we'll have a committee that's really effective at all of them put in the hard work. And sometimes you'll have a committee that you have maybe 5 people working hard and then they try to pick up the slack of the others. So they might not have the full capacity to do actual hard work.
And that's really a microcosm of real life as it's playing out in the real world,
yes,
is it not?
Yes, exactly. So even if you look at it, like right now, the universities across South Africa, so in KZN and at Wits, there's protests happening. Protests about young people who are excluded because they have bad debts. The university won't register them because of it. There's no accommodation. So how do we as MSA also get engaged in those things? And we are trying, as a committee in the last few years, trying to get young Muslims active in those situations so that they understand that we're not just, there's not just privilege that we live in, but we're part of a broader society. And that means we must contribute to that society. And how do we do it? We have solutions. The Waqf system, for one, it's sustainable. You can, invest in accommodation, in students' education. Those things are things that the MSA now must carry through.
So you're engaging with Al-Khal Foundation South Africa?
Indeed, they are one of our key partners in the
there
MSA.
You go.
Yeah.
In terms of the MSA, it's called the Muslim Students Association. What about non-Muslims that want to become affiliated with you? Do you open up a space for them? Do you allow them to come in? Do you embrace them at all?
I absolutely believe so. I can speak again from my experience with our committee in the last year. We made a point of saying, we can't just be interested in ourselves, right? And especially when you're at university, there's such a huge opportunity for you to reach out to people, to learn more about their cultures, to interact with people who are coming from a different background. And in the process of that shared engagement and the mutual respect that creates, we also get to share more about Islam and to educate people about what Islam means to us. To give you an example, last year our committee hosted dialogues at the university that were attended mainly by students who weren't Muslim. These dialogues focused on issues of culture and identity, looking at oppression and liberation, looking at the question of manhood and masculinity, and the conversations that emerged out of that allowed us that opportunity to really get to know students beyond our insular circle.
And also on that, so a large portion of Muslim students come from the Muslim schools, and these schools don't have learners don't have the opportunity to mix with other people of different races, cultures, religions.
And it's a culture shock when they enter university.
It's a massive culture shock. And for us to be able to be there to guide that kind of, the transition is important, because they learn a lot more from it. And that it shows in the kind of events like Asif has mentioned, that a lot of non-Muslims are interested in that kind of space.
Okay, we are running out of time, and the very important thing I know you guys are here to discuss is Back a Buddy. So tell us about it very quickly.
So Back a Buddy is an online crowdfunding platform. For those who don't know, crowdfunding basically means if there is an initiative that needs support, the information is put out online, and then individuals can contribute as much as they want to supporting that initiative. We've set up a Back a Buddy platform page for our conference that's coming up in March. And our appeal is to the Muslim community and whoever is watching out there to support us in whatever way they can, in the form of sponsorships, in the form of individual contributions.
Have you had any response up to now?
Because we just initiated it, I think the response has been a bit slow, but we do intend to boost our social media presence and do a whole lot of media work so that we can get exposure and get the word out there. I think people need to be aware of this first. So it's important that they know that any contributions is welcome. Like if it's 10 Rand, it's fine, because the thing with crowdfunding is that the contributions, they pile up, and eventually 1,000 small donations ends up being a lot, in the end.
What's your target for Back a Buddy in terms of monetary value?
Our target at the moment is sitting at around 300,000 Rand. And again, that goes towards covering the cost of accommodation, the venue, the speakers, transport, etc. And for those who may, be questioning whether or not to contribute, my only comment in this is, let's think about what are you investing in at the end of the day. We're not just investing in a conference, you're investing in the future of our community, you're investing in the future of our society. And our hope is that even if one person benefits from all of the work that's going into this, alhamdulillah, we give thanks to Allah for blessing us with that opportunity to be those
Give
vehicles.
us a taste of the type of topics you're going to cover at the conference, because I'm sure you've already given thought to that, but very quickly.
Okay, so some of the issues that we're going to be looking at are organizational sustainability, so obviously that with regards to the MSA, but we also want to engage with issues of transformation as far as race, class, gender are concerned, looking at politics and international relations, dealing with dawah and tarbiyah. Effectively, these are some of the issues that we feel, if we can hone in on those, and governance, and the issue of student governance. So how do Muslim students and the MSA chapters relate to the student governance space and the student political space that is very active at our university?
It sounds amazing. So that app is up and running, I presume,
yes.
And people can start contributing, make their contributions immediately.
Yeah.
Okay, and very quickly, a quarter of a minute left. What would you like to say?
I think it's just that it's an investment in young people in the future of the country. So you're not going to be able to see it tangibly right now. But in 10 years' time, in 20 years' time, you're going to have a socially conscious body.
Inshallah, and that's where we leave it. And that's where we've got to leave it, unfortunately. We've ran out of time. Thank you for watching. I do hope you've enjoyed it as much as I've enjoyed your company today. Till Saturday morning at the same time, as always, take care on the roads. And it is Khuda Hafiz from me, Julie Alli.
قلبي على جمعة الخير هلا، حني قلبي على جمعة الخير هلا، يا هلا ويا هلا ويا هلا ويا هلا، يا هلا ويا هلا